Hi everyone, thank you for coming. My name is Anna Natrakul and I'm studying cell and molecular biology in the College of Arts and Sciences. And my Keystone advisor is Dr. Jessica Liebler, who's in the BU School of Public Health. She's been an amazing mentor through this process, and I just want to say thank you to her. And my project is all about investigating possible causal factors for a specific type of chronic kidney disease. So my title is Investigating Associations between Medication Use and Kidney Health in Nicaraguan Children. So what we're talking about here is Mesoamerican Nephropathy, abbreviated MEN. It's a specific type of chronic kidney disease, but it has an unknown origin, so it's also frequently abbreviated CKDU. This is a rarely recent phenomenon. Epidemiological research didn't really pick up until the past decade. MEN has a unique pathology compared to other types of CKD that we would see in higher income countries, where it would often co-present with morbidities like diabetes and hypertension. In contrast, MEN affects mostly young people and mostly men in sugarcane industries and agricultural field working conditions. Because of the existing poverty and limited access to medical care in these regions, this is a really serious issue, and it's a leading cause of death in the region, which is why I wanted to focus on it. Just a little bit more background. This map here on the left, you can see kind of the hotspots for MEN are kind of in that gold highlight. You can see that they're in kind of rural, coastal lowlands of Central America. And I also wanted to point out some of the circulating possible causal factors of what people have been investigating so far. On the right, the one that I'm going to be focusing on is use and abuse of NSAIDs, which stands for non-steroidal anti-inflammatory drugs. You may have heard of these. These are your typical ibuprofen, naproxen, and these have been known to be somewhat nephrotoxic by nature, so we wanted to investigate that. And it has been said to be a high priority hypothesis to investigate for this disease, which is why I wanted to look into it. So my research question is here asking about if there are associations between high usage of those medications and kidney health, particularly dysfunction, in Nicaraguan children. And my hypothesis, again, because this is a high priority one, I was anticipating that there would be statistically significant associations between those variables. The variables I listed here, just so everyone is clear, the exposures that I'm looking at are those pharmaceuticals like NSAIDs and also herbal remedies. My outcome variables are something called eGFR, which stands for estimated glomerular filtration rate. It's a measure of kidney function. And also this outcome called dysuria, referred to as chistata in the region, which means painful urination. And this is a common indication of MEN that we're seeing in children. And that brings me to the Hoviness study, which collected kidney health data in Nicaragua, specifically in children. The reason why we wanted to focus on children is because, again, this disease presents in very young adulthood, so we wanted to look for any indications of kidney injury or disease at early ages before these participants enter working age. And so my project looked at 2016 data. I had almost 700 participants, and we collected interviews and lab specimen samples to kind of get a sense of what the participants' demographics, their family history, and their kidney health metrics. So we asked a lot of different interview questions. The ones that are most relevant here for me and my data analysis was particularly something like this, asking about chistata or dysuria. And you can see this is from the survey. We asked about whether they'd ever experienced this symptom and how often. And then also this is the medication part of the survey. You can see the top part is kind of the qualitative section. We asked about herbal remedies that participants were using. And this was an important piece because a past epidemic of nephropathy had actually been traced its causal agent to an herbal tea, so we wanted to look into that here as well. And then we also had a quantitative piece where we asked about those particular categories of medicines I talked about and asked for specific frequency numbers that participants had been using them. We wanted to focus specifically on frequencies of at least once a week or more, because that was the threshold we felt would have a significant effect on kidney health rather than something like over the past year. And this is just a breakdown of the methods that I use. So again, there's a quantitative and a qualitative arm. For the quantitative approach, I first did initial comparison tests in RStudio and then tried to recapitulate those findings in Stata using adjusted regressions. And then I also did a qualitative data piece, which I'll talk more later, where I translated free responses about those herbal remedies from Spanish to English and then created a code book with labels that I used to kind of analyze that qualitative data. And just briefly to go over the quantitative approach, so again, I did those initial comparison tests, things like chi-square tests and t-tests across a series of common medications and across a series of core kidney health outcomes, things like eGFR, Chistada, age, sex. And then I tried to recapitulate those results, again, using adjusted regressions, using the core outcome variable of eGFR. So from the quantitative approach, initially I did see some significant associations in those first comparison tests, specifically between acetaminophen usage and eGFR. Low eGFR is an indication of kidney disease in children, and then also between kind of an aggregate variable of multiple different types of medications being used at high frequencies and low eGFR. However, when I tried to recapitulate those results in Stata with adjusted regressions, they did not return as also being statistically significant. But I did see kind of a consistent broad association between that chistada, that painful urination symptom, and high use of medication. So there was still some associations here, but we did not see any robust statistical significance. And then since we talked about the quantitative approach, going into the qualitative approach a little bit more, I mentioned how I translated the free responses and created a code book. So I wanted to just talk a little bit more about that. The code book, I basically used labels of categories and themes. Categories being the type of herbal remedy used, whether it's like a plant or a spice or an herbal tea, and themes being the reason for use, whether that be a cold or flu symptom, menstrual pains, anxiety, and things of that sort. So this is kind of just a screenshot of my initial code book. This data was pretty tedious to code, and so the category and theme pairs were actually extended far beyond the screen, but I just wanted to show you guys the first pair of them to give you a sense of that. And then so results from this qualitative approach, which is really interesting because this allowed us to describe participants' experience with medication without kind of trying to make any claims to causality, and really allows for a rich data set. So we did find that almost over 40% of participants did report using herbal remedies, and a high percentage of almost 80% of those reported weekly use of teas. And I kind of listed those teas here. And this is interesting, again, with what we know about what happened in the Balkans with that nephropathy being traced to an herbal tea. We also found a significant, more than we had originally thought, saying that they specifically used herbal remedies for their renal system. And so just general conclusions from this, we still did observe, again, those broad associations, but we didn't see quantitative statistical significance between at least NSAIDs per se and kidney dysfunction. But we did notice that association with Chistada, which is worth looking into further. And some more broader significance about this project. This still moves the field forward because now we kind of know that at least in this population of children, NSAIDs medication use isn't maybe having a key causal role in kidney dysfunction at this age, but it's going to inform future rounds of our cohort study, and it's also going to encourage us to look deeper into those herbal remedies now that we have this really rich data set of qualitative data and details on herbal teas. And that is all I have. Thank you. And I'm happy to take questions. Yes.
Is there a genetic component to this? Like, I know you're looking at a lot of the environmental component to the CKD, but within this population, did you see any of the genetic component?
Yeah, so my project specifically, we strategically chose like very narrow variables for this, but one of the, like our interview questions did interrogate and probe into like family history of CKD, and particularly because we're looking in young people, again, we asked about whether adults in their family had this, and that actually informed how we divided up the different types of regions. I didn't go into this, but we had like high-risk regions and low-risk regions that we looked at across for this data. So not specifically for the scope of my project, but that is included in this data set, and it did kind of inform our parameters and allowed us to look at both high and low-risk regions for these children.
Thank you.
Mm-hmm.
I'm not sure like the big difference between eGFR and GFR, but I know that in the US, GFR like often underestimates the severity of kidney function in like ethnic and racial minorities. So do you think that had like any impact in your study since it's outside the US?
Yeah, so I know that I'm not super well versed in the differences between eGFR and GFR, but I do know that for our study, we use eGFR and we use the bedside Schwartz equation to kind of get that number. And what I do know is that something we were looking into, since we're dealing with children and obviously their kidneys function differently than adults, to use kind of a slightly adjusted, newer equation that would be more accurate compared to like a normal adult population that we would see. So that's something that we talked about. As far as eGFR versus GFR, I'm not exactly sure, but that's a really interesting point to bring up. Thank you.
So I was wondering, you began by talking about young men in sugarcane fields, and
Yes.
then transitioned to the children. And so naturally one would think are these young men having this condition because of their work, and the sugarcane is treated with some terrible insecticide
Yeah.
or something like that.
Yeah.
But what struck me is that it could be that the young men of today are the children of 10 years ago, right?
Yeah.
And so what potential is there for your studies to, for example, dovetail into other people's studies, right, to try to see that much more longitudinal evolution of certain factors? I just
Yeah.
seems to me that could be challenging, but maybe accessible.
Yeah, no, exactly. And it does dovetail with a lot of other studies. So the research team I got to work with, I'm super fortunate, has a lot of sprawling studies with adults and with kind of cohort, more longitudinal work. So I use cross-sectional data from just a singular point in time. But it definitely does have implications for that as well. And with adults in the region. One of the other hypotheses, I kind of only showed it for a minute, but actually was insecticide use and other kind of environmental exposures you would expect from hard manual labor in the fields, and that is also being looked into as well. So our cohort study now, actually, the children from 2016 are older now, and so the next round we are going to get data from those same participants, and we'll be able to kind of see what may have changed. So that's definitely an exciting avenue.
Any other questions for Anna? If not, please join me in thanking Anna again for a great talk. Thank you.